flu bug's still going around big time, unfortunately, but if you do get sick, how do you know if it's the flu or just a bad cold? Well, joining me now is Dr. Frederick Lippmann of the UMC Peccole Ranch Primary Care. Doctor, thank you so much for being here. We
Glad to be
appreciate it.
here.
Yeah, a lot of us, we don't know. We say, oh, it's just a bad cold. I'm going to sort of muscle my way through it.
Right.
How do you know?
You know, it's a tough call. A lot of people just think they have the flu when they've got a sniffle, and some people don't even worry about it when they've got pneumonia. But basically, if you got a cold, you're going to be, sniffly nose, maybe a little congestion, mild sore throat, maybe some aches and pains, rarely a fever. Take the flu, though, and you can take everything that a cold is and just magnify it by 10. Oftentimes you do have a fever, maybe just low grade, 101, 102, but you're much more congested, more headaches, more nausea, vomiting, perhaps even diarrhea. Your muscles just are painful, your joints ache. The flu actually just, as somebody else said, just feels like you've been run over by a truck. And that's the flu. And
you were saying this time, this year compared to last year, is a huge, huge increase with the flu here in Las Vegas.
That's what I understand. Between 60 and 90% increase reported flu cases in southern Nevada.
More so this year than last year. That's incredible.
Compared to last year.
Okay, some of the ways to get over colds. We always hear the thing about sweating it out, right? A lot of people like to do that. I'm going to go to the gym. I'm going to go for a run. That's a bad idea. Why?
Exactly. Because if you've got a virus of any kind, whether it's just the coronavirus causing the common flu, common cold, or the influenza virus, there is something that you could have cardiomyopathy from that virus. And so you don't want to necessarily, sweat it out. You can cause just more damage. You can cause some muscle degradation as well. So you want to take it easy. You want to rest. The body only heals when it's resting. And so lots of fluids, supportive care, whether that's some ibuprofen or some acetaminophen of some kind. Again, fluids, fluids, fluids. Rest when you can. We're big proponents on not going into work if you have the flu. Try to keep your kids home from school if they've got the flu as well. Because when we go into work and think I'm going to tough it out as well, we're spreading that around.
Yeah, we see that a lot. So is there a timetable that you would suggest when you would say, okay, maybe I have a cold and it's a day or two, where then all of a sudden you say, well, now this might be something more?
Yeah, it takes about you should know within a day or two exactly that whether it's cold or the flu. Again, just take all those things. Do I have a fever? How bad do my muscles ache? How bad do my joints? Can I get out of bed? Is my head spinning? Do I feel sick to my stomach? Those are the times when you want to come into a quick care. And the earlier the better, because the antivirals that we have to combat the flu take effect early stages. If you wait 4 or 5 days, sadly, they're not as effective as they need to be.
Wow, so it's really important to sort of pay attention to those symptoms and know the difference between a bad cold and the flu.
Absolutely.
Dr. Lippmann, thank you so much for your time. I do appreciate it. All right, we'll be right back, everyone.